everyone. My name is Mehr, and I'm so excited to be here today talking to all of you. Today, I'm going to share a story of a journey, my journey. So here's just a little bit about me. I'm a 6th grader at Odell Middle School in Bellevue, and I'm passionate about my community and want to make a positive impact. And my focus is public health. I believe that everyone can make a difference, regardless of age. So my mind has always been occupied by the thought, what if? What if I don't do well on the math test? What if I'm late to school? What if my sister, who's here in the audience today, eats my chocolate cake in the fridge? And so on. When my mom got sick of my what ifs, she started replying, well, what if you actually do well on the math test? What if you're early to school? What if you eat your sister's chocolate cake instead? But most importantly, she asked me, what if you use your time helping people? I was intrigued. How could I, a 7-year-old at that time, actually help someone? Mom introduced me to volunteering, and I was hooked. I started when I was 7 by volunteering at local health camps. And I started by checking in patients and directing them to the different areas of the camp. But slowly, I started actually assisting the healthcare providers, noting down health issues for the patients, and assisting in dental and vision checks. And I really enjoyed it. This was awesome. I was actually helping people. It felt gratifying to see people who had no access to healthcare actually seeing doctors, dentists, and getting their labs done. These were people who were forgotten and ignored by our health system. But what if we could actually help them? And along this journey, I got a chance to meet my idol, Malala Yousafzai. And talking to her made me realize the power of my voice. Every one of us has that power. We just have to get started. I was spurred to action to impact my community positively. My volunteering opened my eyes to many issues that affect our communities. And one of those issues was the annual flu epidemic. And this unwelcome guest claimed many lives every year. In 2018, 65,000 people died from influenza. And there were 700,000 hospitalizations. Now that's a lot of mortality. And we were gifting it forward. So every year, me and my friends received this undesired gift. And guess what? We were spreading it to others like holiday cheer. So what if we all washed our hands? The first health campaign I started is called Clean Hands Save Lives. And I started a hand hygiene campaign triggered by the flu epidemic. And the epidemiology of influenza shows that hand hygiene can be the single most important preventative factor. I wanted to especially educate children because influenza spreads rapidly in schools every year and can be deadly for some kids. So here I have some facts about hand washing, such as only 5% of people wash their hands for the proper duration after they go to the bathroom. That means 95% do not. So that's a lot of dirty hands. Hand washing can reduce the risk of respiratory infections by 16%. So CDC calls hand washing a do-it-yourself vaccine. And I made an audio-visual presentation supplemented by games, videos, and fun experiments for kids. information I provided was very easy for younger children to understand. And I also did an experiment with them. I have both local and global outreach. I presented my project here in Washington, in Michigan, and most recently in India. So here is an image of me presenting to a group of kids, and as you can see, this is a younger me. I talked to kids about where germs like to live on their hands, such as in between the fingers, on the fingertips and nails, and on the wrists. I talked to them about the steps to washing their hands: wet, lather, scrub, rinse, and dry. I also talked to them about when to wash their hands, such as before eating, after using the bathroom, and after sneezing. Here's an image of me doing the glow germ experiment. And glow germ is a cream that, when shown under UV light, highlights germy areas on your hands. And as you can see in this kid's hands right here, the areas that are glowing are areas where they have germs on their hands. I gave them this little rhyme that they could hum while they were washing their hands. Happy birthday to you, your hands are a zoo. If you hum this while you wash them, they'll be cleaner times 2. I decided to turn this into a research project to gauge the effectiveness of my campaign. So I gave the kids survey questions before and after my intervention, and I calculated the mean, standard deviation, and p-value. My results showed a statistically significant increase in their knowledge after my intervention. And not only was I able to raise awareness about hand hygiene compliance, but I was also able to create hand hygiene ambassadors who were then able to spread this information along to others. Here's a little table that shows my results. And this table shows the standard deviation and p-value. This was not only an opportunity to help the community, but also an amazing opportunity for my own personal growth. It helped me realize my potential, overcome obstacles, and believe in my convictions. So here I'm presenting at a community center and talking to people about hand hygiene. The success of this first campaign triggered me to find some more issues in our communities that needed attention. And one of those issues was healthy eating. So I started a campaign called Operation My Healthy Plate. This idea germinated when I saw patients at health camps coming in with chronic health conditions like diabetes, hypertension, and heart disease. They were on multiple medications, but lacked awareness as to what they could do in terms of small lifestyle changes. So I thought to myself, what if I could raise awareness about this? The main takeaways at the health camps were that healthcare distribution is unequal, and we need to find a solution to that. And there's a lack of awareness in terms of what people can do in terms of lifestyle changes. So this is what you should not be doing. My project goals were to create awareness and focus on disease prevention rather than cure, empowering people to take charge of their own health, which means partnership with their healthcare providers, doctors, and nurses to improve their quality of life. And I got support from a nutritionist, and we joined forces to identify the major health issues, create brochures and educational pamphlets giving information about those health issues, and come up with diet plans and healthy recipes tailored to those health problems. We help patients at the health camps create their plate, and we encourage people to put a line down the middle of their plate and split their plate into 3 sections. and filled one section with non-starchy vegetables, the other section with starchy foods, and the last section with protein. And we talked to them about some healthy food options in this table and the serving size recommended. Now, I know cupcakes are tempting, and I'm sure that if I brought cupcakes in here, all of you would be eager to eat them. But they're classified as one of the unhealthy foods, so you should try to avoid them. We encourage people to rethink their drink, because what you drink is just as important as what you eat. We gave them this table that shows alternate options for drinks. We also encourage people to account the amount, because research shows that people get full by the amount of food they eat, not necessarily the number of calories that they take in. We gave them these tables that show alternate options for food. And here are some images of some of the people that I helped at the health camps. We encourage people to make half their plate fruits and vegetables, because there's so many ways to eat fruits and vegetables every single day. The In Motion initiative. I came up with the idea of incorporating exercise along with this, because it was hard to get people moving. And we aggressively advocated exercise for each individual at the health camp and encouraged people to make exercise logs of daily workouts. So here's an image of me at the health camps and talking to people. This is just a glimpse into our health camps. My what if actually led me to find solutions to problems in my community. That was surprising. And it channelized my energies. This was my journey of personal growth, and I now have a voice. And my calling is to help the community. Thank you.